All right, thank you. Thank you for bearing with me. We have three fantastic presenters today that I'm very excited to bring on. So today we will be starting with a little bit of a background from our good friends at Startup Health, and we'll move on to hearing more from Miguel Johns, the CEO of DiabetesCare, Bryan Mezue, the co-founder and CEO of Lifestores Healthcare, and we'll wrap up today with Areva Martin, the co-founder and CEO of Butterfly Health. But before we get too far along today, I do need to pause and do a little bit of housekeeping. So please keep in mind that today's session is live and we are recording, but the recording and the slides will be available on our Dime website afterwards. And of course, with the power of live sessions, the fun comes from the conversations that we have with you, the audience. So if you do have a question, don't be shy. Please type them in the chat function or raise your hand. And I might even unmute you to ask your question live to our great panelists. Okay, so now let's go ahead and get started with what we all came here for. So let's have a little bit of introductions then. Anne, can I ask you to please start and give a fantastic introduction about Startup Health?
Yes, of course. So to introduce myself first, I'm Anne. I'm the platform and portfolio manager at Startup Health. I've been along Startup Health's mission for the past 4.5 years or so. So I've seen quite a few, ups and downs and twists and turns with the Startup Health mission, or with the Startup Health business. But one thing that stayed very clear with Startup Health is the mission to invest and unite a global army of health transformers. Health transformers are what we call our amazing entrepreneurs, 3 of whom you see on the screen, who are focused on being committed to achieving health moonshots. Our health moonshots are big, lofty goals to help the health and wellness of billions of people across the world. We have 12 health moonshots that include access to care, cost to zero, cure disease, etc. And more recently, we've added in the health moonshot of pandemic response, which I believe is going to be very relevant in the next couple of years. So a little bit of additional background: Startup Health launched in 2011 and is one of the most active investors in digital health globally, with over 350 companies in over 26 countries, of which more than 75% of our portfolio is still active today over the past 10 years. With our Startup Health moonshot investing model, which is inspired by NASA's successful Apollo program, it's designed to support the unique challenges of entrepreneurs working to achieve audacious health goals. As you'll probably hear from Bryan, Miguel, and Areva, they are working to accomplish really, really difficult challenges. We've found that the 5-step model within Startup Health, investing seed capital alongside the long-term commitment of entrepreneurs, uniting them as a global peer community, broadcasting their stories of success across the world, connecting them with our global network of vetted investors, customers, and partners, and collaborating with the blue chip organizations and families who share all these long-term goals can really help them accomplish these missions. We really believe in our investing model as well as all of our entrepreneurs, and helpfully speed the progress up to accomplishing these goals in shorter time periods. I won't take up too much time to go over Startup Health. I know that's not necessarily what everyone's here for. And as always, we want to make sure that the focus is on our entrepreneurs. So I will pass things back to you guys.
Awesome. Thanks so much, Anne. I really appreciate you making the time and for Startup Health being so willing to partner for this great event. Ever since I learned about the fantastic mission of Startup Health, I've been starry-eyed, and it's been fantastic to bring on these great presenters today. So thank you so much. Let's go ahead and jump in. Yeah, how about we get started with you, Miguel? Would you care to give our audience a background on you and on DiabetesCare?
Yeah, definitely. First off, thanks everybody for joining. Thanks for having me. Really excited to be on this panel and to be tackling health moonshots and increasing access to healthcare on a global scale. So my company's called KingFit. I'm a co-founder and the CEO, and I started KingFit because I come from a long family history of diabetes. Dad has it, grandma has it, and when my grandmother was diagnosed with diabetes, she told me she wanted to eat healthier. She said instead of drinking chocolate milk, instead of drinking soda pop, she was only going to be drinking fruit juice and chocolate milk, which of course have just as much sugar, are just as bad for her with her condition, and really opened up my eyes to the lack of understanding she had about her chronic condition. And so that led me down a path over the last 5 years to produce over 1,000 bite-sized educational videos in collaboration with certified health experts around diabetes, and start to get this content and education in the hands of people with chronic conditions around the world. Starting with Facebook, we were able to reach out to people using social media, using bite-sized content, and start engaging them in new ways by simply asking different questions. Instead of thinking that people were only able to be helped with a chronic condition in the hospital, in the doctor's office, where else could we meet them that was easy for them to understand, easy for them to access, and would allow people who didn't have access to traditional means of healthcare or high quality healthcare to also be able to start gathering those resources and moving down their pathway of improved health outcomes. So our product DiabetesCare today is hosted on social media platforms because we're able to reach people all over the world that way. You can see a few different ways that we've changed the user experience for somebody with diabetes, all video based, all digital based, where they can come to our page, they can Netflix binge a diabetes education course, they can learn from the best in the world, and they can easily text us or WhatsApp us for more information, more resources, and we can help them move further down their pathway to improved health outcomes.
Great. Thanks so much for that, Miguel. Very excited. I've already got some questions kind of lined up for you. Let's pass the ball to Bryan. Bryan, do you care to give a fantastic overview of the work that you're doing?
Thank you so much, Rachel. Yeah, absolutely. And just like Miguel, very happy to be here, and really appreciate being next to these great panelists. And thanks so much for organizing this as well. It's awesome to kind of share the story of Lifestores here. I'm Nigerian of origin, grew up there, but have lived and worked all around the world. And one thing that I've always cared a lot about is about the image of Africa and how people kind of see Africa and how that's changing. And it's important to me that innovation, as it's kind of speeding all around the world, is also changing the image of Africa, just like it's done in so many other countries right across the world. And healthcare particularly matters to me because my family is very deeply in healthcare. My dad is a doctor, my sister, my brother are doctors, my uncle's a pharmacist. My mom's a nurse. I'm kind of the black sheep that didn't go into healthcare initially, but got pulled back in after a while. And it's really interesting, right? Because access to healthcare is really broken. The farther away you get from developed markets where it's a little bit broken, the more broken it gets. For example, 95% of people pay out of pocket in Nigeria. Fake drugs are a massive issue. The drugs that you do get are often very expensive. And these are issues that people face on a day-to-day basis. And really for us, myself and my co-founder, the thing that drew us into this was just understanding that the journey for patients is actually quite different than what we might be used to in more developed countries. And pharmacies especially play a really interesting role in that journey. Typically, if you're sick, you might go to a doctor or family physician if you're in the US, but if you're in Nigeria, you typically will go to a pharmacist first, and then they play this first point of entry role into healthcare. But pharmacies face a lot of issues, right? So firstly, they're very fragmented, and they struggle to buy medicines efficiently. They struggle to collect data. They struggle to figure out what's real and what's fake. And so, we really started by firstly running a couple of pharmacies ourselves to understand these issues better. And then over time, we built software that powers pharmacies, effectively kind of the infrastructure that runs pharmacies. We do everything from helping them pool their resources together and buy medicines at a cheaper price directly from manufacturers, as opposed to going through multiple layers of distributors. We help them with day-to-day patient data gathering. We help them with telemedicine, when it comes to that, and really just digitizing the way that they run their businesses. We've been doing this for around 3 years now. We have around 100 pharmacies under our network that we support. And COVID is just kind of elevating the role of what we do, right? Because people are speaking about pharmacies as the distribution channel for vaccines and, gathering information and sharing information to patients. And yeah, we're just really excited to be part of that journey and really play our part in democratizing access to healthcare. But excited to be part of this panel and looking forward to the conversation to come.
Fantastic. Thanks so much, Bryan. Very excited about what Lifestores is doing and excited to learn more about what you're doing today. All right. Last but certainly not least, we have Areva Martin, who has a few different job titles. But would you mind giving us more background about what you're doing and give us more information about Butterfly?
Yes, good morning. My name is Areva Martin, and I am the co-founder and CEO of Butterfly Health. And Butterfly is a digital therapeutics that's focused on providing digital solutions to individuals who have behavioral health needs. And 1 out of 3 people in the United States in particular have some kind of mental health issue. And unfortunately, most of those mental health issues go unmet, and particularly in underserved and underrepresented populations. So Butterfly really focuses on those populations that typically have difficulties in accessing mental health care, either because of a lack of trained providers, due to stigma that they may face or perceived stigma around seeking mental health care, cost, and the fragmented mental health system. We really focus on Medicaid populations because Medicaid is the largest provider of mental health services in the United States. They spend over $90 billion a year. We also sell into health systems because we know that many individuals end up in emergency rooms, overuse of primary care physicians, and overuse of medications because of unmet mental health needs. So Butterfly is a private, secure 24/7 intervention that's both web-based and Android and iOS based, so people can, at their leisure, use the platform. They can participate in peer-to-peer forums, meet individuals who have similar healthcare needs, emotional needs, behavioral health issues as they have. They can participate in our what we call empowerment kit, which has videos, which has exercises, CBT, DBT, all clinically based therapeutic modules that have been designed really with the needs of unmet populations in mind. There are a lot of mental health apps that are available in the marketplace, but we differentiate ourselves by providing culturally and racially sensitive interventions. So we meet people where they are. We look for their intersectionality, be it race and gender, be it identity and race. So we like to say that you're going to see yourself in the language and the images and in the therapy that you receive on the Butterfly platform. I come to this work having been an advocate for underserved populations who have primarily in the disability space, but really excited to be a part of Startup Health and to really address what has now become probably the second largest health crisis in the world behind COVID-19 is the mental and psychological impact that individuals are feeling as a result of the pandemic, both the pandemic of the virus, coronavirus, as well as the pandemic of race, which we have been grappling with in this country for decades, but really became more acute over the last summer. So that's the Butterfly story.
Fantastic. Thanks, Areva, especially talking about the tale of 2 pandemics, right? It seems to affect folks differently. But Areva, you mentioned a lot about kind of access, which I think is something that we think a lot about when we're developing digital medicine products. So not only does the technology have to work and be fantastic, but a big question is regarding how do folks access these kinds of tools. Access can be related to cost or geography, for example. So whenever you're thinking about creating these products and removing as much as possible barriers to access, how do you and your companies think about how your products can curb the digital divide rather than create it? And I'll start and ask Areva you that question first.
The way we think about access is we think of underserved and underrepresented populations. And that's why a big part of our business model is focused on Medicaid. A lot of companies, shy away from Medicaid because they see it as this big bureaucracy. But in a prior career, I had an opportunity to actually sell into Medicaid plans and to establish contracts. So I come to this work with an understanding of how to work within the Medicaid and Medi-Cal system. And yes, it can be complicated. Yes, it can be bureaucratic, but it also can be both a positive way to have social impact and to really impact the lives of people who often aren't thought about when digital solutions are being developed. But it also can provide a really viable business model for a digital therapeutics company like Butterfly. So we know if we can sell into healthcare plans that focus on underserved populations, on folks who are at or below the poverty line, which a lot of Medicaid recipients and Medi-Cal recipients are, we then can get digital health into the hands of those people.
Thanks for that. Yes, I think that addressing the question of access is always difficult, but also always worth it. So thank you for your feedback there. Bryan, I'm going to throw the question to you if you also don't mind. You talked a bit about how about the experience in Nigeria. Can you talk about how Lifestores looks at looks at access?
Yeah, no, I think it's a great question, right? I think there's different layers of access, and really a lot of what we're working on is what we call essential, healthcare access, right? It's firstly around, being there and being able to serve people in emergencies, and pharmacies play a role in that. They're not the only players, of course, but if somebody has, some sort of illness and they're not sure what it is, they can go to the pharmacy and double check, is it malaria? Then they do a quick check, and you can do those things. But I think increasingly we see access as also kind of being more holistic and, kind of thinking through planning ahead of time before you're sick. So if you have kids, a lot of our average customer to the pharmacies that we serve is maybe a mom, with kids, or young families, right? And they want to plan for their kids ahead of time, so vaccinations and vitamins and things like that. So there's a bunch of education as well that has to happen to move you away from that place where you're reacting to things that have happened to you, to a place where you're planning for things that may happen in the future. And so we see it, both ways. So we want to be there for the essential reactive access, but then we want to educate people for that longer term, proactive access, if you will.
Yeah, great. I think pharmacies are also turning into a lot of people's first place of care a lot of times. So you're dealing with a really complex sort of needs from the people that you serve. I'm also going to ask you that question, Miguel, as well about access. So I understand that DiabetesCare also provides a lot of educational opportunities for the Spanish-speaking population throughout the world. Can you talk a little bit more about access to, and also you talked about your mother, I believe, who was talking about how she's dealt with it. How does she find DiabetesCare to be really accessible for people like her?
Yeah, so it's my grandmother. So when she was diagnosed, she was pretty much just kicked out into the wilderness. And so what really opened up my eyes this year when COVID hit is we were already on the social media platforms. There was an access problem, not only internationally, which we've seen and I'll talk about in a second, but in the United States. So people were losing their job, they're getting furloughed, and we would get messages every day. Hey, I just lost my health insurance. How am I going to get my medications? How am I going to see my doctor? My A1C is 10. I need help. So that was a big eye opener when the pandemic hit, was the amount of lack of access that just immediately hit the United States. Now, in the US and in the Western world, we're a little bit spoiled. If we're feeling sick or need to see the specialist, we can usually just drive down the street, but that's not the case everywhere. We have a lot of Spanish-speaking individuals who contact us who say, hey, I've never met a diabetic specialist. I've never seen a diabetic doctor. I don't know what I'm doing. I feel lost. And as we started answering those questions and putting out more content in Spanish, that attracted people from across the border. So at first we were saying, okay, well, we can serve people down in lower Texas and lower California. And then all of a sudden we start getting messages from South America and Mexico. And just by bringing one certified diabetes educator onto our platform to host a webinar, we had 1,000 people from Mexico sign up in a matter of a couple of days, which really showed me these people are hungry for the guidance. They're hungry for the access. And what's funny about social media is it's grows so fast, and it's so much that it's everywhere. I think Facebook, their number right now is 2.7 billion monthly active users. which shows me that more people have access to social media than they do to healthcare. And so, which is a sad thing, but also it opens my eyes to, we've got to start thinking of these unique ways to start getting in front of people, helping them, grabbing them by the hand and guiding them through the next steps. And I think social media opens up the door to do that, even though it's got its plus and its minuses, because it is kind of taking over our lives, but it's also increasing the access to different people around the world so we can understand their problems better in this situation, specifically around healthcare.
Thanks, Miguel. I appreciate that. Yeah, the comment too about how more people have access to social media than healthcare is quite a shame, quite honestly, globally too. And so I want to kind of turn the next question to thinking more about, Startup Health's mission about increasing global access to care. Unfortunately, it looks like access to care is not the right that we all think it is, but it becomes a question of how do we get people to access it? So my question is, with the difficult conversation about access to care, how do your teams kind of grapple with that? Both whenever you kind of sketch out the mission for your company, how do you pitch this to investors? How are you able to kind of look at grappling with providing healthcare to the whole world? And Areva, I think you have to jump off pretty soon, so I'm going to give you that question first again.
Yeah, one thing that I think about in terms of access to care is representation, and that's why I think it's so important to have more people of color represented in the health tech space. As you all know, everyone on this call knows that when you think about VC investments in health tech and tech in general, the numbers are abysmal, particularly when it comes to African Americans, and then even more abysmal when it comes to African American female CEOs or founders of health tech. So I think when we think about addressing everyday persons or people's access to healthcare, we have to think about who are the people leading the charge. And if we want to see access, we want to break down some of the barriers that prevent people from having healthcare across the globe, we've got to think about how do we invest in those founders that are laser focused on those populations that have traditionally been left out of the healthcare system. So I think myself as an African American woman, the other founders on this webinar who are of African descent, this is where it starts. It starts with us. It starts with us telling our stories. It starts with us representing our companies before VCs, before health plans, before health systems, and before everyday people that need access to healthcare. Because if we don't have more people of color, able to start and to sustain health tech companies in this space, I think trying to improve access is a fallacious proposition. I don't think we get there. So, companies like Startup Health that see the value in diversity, that see the value in investing in diverse companies, I think is the way we start this conversation. And the way we sustain it is by seeing more companies like Startup Health making the kinds of investments that are going to allow us to start, grow, and sustain companies like the ones participating in this webinar.
Thanks, Areva. I really appreciate your viewpoint there. I could not agree more. My head is a bobblehead about to fall off because I agree with you so much too. That is exactly the kind of conversation that needs to continue happening, especially with the growing digital medicine space, absolutely, and particularly with digital medicine. Dime's webinar in January of this year featured Rock Health. They put out their diversity in digital medicine layout of what it looks like throughout founders. So I invite everyone to look at that report and our webinar to talk about how the funding world is different amongst different demographics, primarily amongst men and women and people of color. So do take a look at that. And while there is work for minorities of any kind to continue advocating for ourselves, I also continue to invite majority group members to spend a little bit more care about what privilege looks like when it comes to healthcare access or even access to funds or VC opportunities. Areva, I think you have to jump off pretty soon. So if I don't get a chance to ask you another question, thank you for joining and for your fantastic.
No, thank you. Thank you for doing this and for lifting up this conversation. So incredibly important and just honored to be a part of it. So thank you.
Thanks, Areva. You honor us with your presence. Thanks so much. All right. So I'll actually toss that question to Miguel then. How do your companies kind of grapple with the aspects of kind of access to care globally?
Yeah. So like you mentioned, it's daunting, it's audacious, and it can be nerve-wracking, and it builds a lot of anxiety for the entrepreneur. For us, one of the things that helped at the very beginning is we have an investor slash advisor who's built a digital health company themselves. And so the mental calming that that person can bring to just ensure, hey, focus on the end user. You're helping somebody, you're improving their life. The more you do that, the more the models and the opportunities and the partnerships will show up. It'll take time, it'll be hard, but if you can just pour yourself into that service and making that technology and that healthcare product accessible and people are using it. His big thesis was he's never seen somebody not figure out the business model if they're truly making an impact on the person's life. And of course, at times that's really difficult to remember when you're in your second, third year and the traction hasn't picked up or the users aren't responding how you'd like them to. There's a lot of mental battles you'll have to get through. But that's why I just respect anybody who's taking on this moonshot, because of the challenge that it is. If you're really trying to improve access on a global scale, you're going to run into so many different systems. As we know, even in the US, it's fragmented. So imagine going from a different country and all these other things, and you get into some areas where, for example, when we had 1,000 people reach out to us from Mexico, at first, my team's like, wow, this is amazing. Let's start charging them to sign up for XYZ, just to quickly find out that they don't pay with anything with cards. They use cash, and we couldn't collect cash from people in Mexico. So there's all these obstacles that start to pop up. But when you're truly helping somebody, and at the end of the hard week, when something didn't go your way, you get that testimonial in that says, hey, I lost 5 pounds. My A1C dropped by 1. I could have never done it without you guys. And I would have never imagined this. I randomly came across your video on social media and it led to this. Those little wins, I think, are so important to keep you mentally healthy through the process, because it's going to be a process. It's going to be difficult. It's going to take time. And so for us, having that advisor slash investor who had been there, who had done that, who could just assure us, focus on this. And then 2, us counting those small wins of actually helping somebody, that's helped us a lot to continue the mission and try to figure this thing out.
I really like what you share there about you got to celebrate the small wins to keep yourself mentally healthy. I think that means a lot too, especially for entrepreneurs doing great work, often to solve difficult problems. Bryan, I'll give you that question next.
Yeah, no, I think, I couldn't agree more, right, that the challenge is a challenge, right? There's a reason that it's called a moonshot. I think, case in point, right, let's look at COVID and let's look at the vaccination drive. It's fantastic that we have these vaccines in record time, right? And people are starting to really, put them in arms. But what's going to happen in 6 months' time when the richer countries have mostly vaccinated their vulnerable populations, but the poorer countries, are still figuring out how to get those vaccines, especially given kind of the more difficult supply chain and logistics challenges with, some of the more advanced vaccines. And so, this really just kind of illustrates that point of, how fragmented the global system is and how it doesn't really speak to each other. It's almost at the opposite end of the spectrum from, let's say, the financial system, right, where you have these partnerships between banks and these understandings in how cash is transferred from the most random country to the most advanced country. And we need to get to something closer to that in healthcare, right? And it starts small. I think it starts with everything that we're trying to do locally, and then it grows to a more global movement. But I definitely agree. I think for sure funding is a big gap. We see that I think across the lines of gender and minorities, but we also see that geographically. I think that, the farther away you are from, more advanced countries, the harder it is to raise money for moonshots. And then we also have, challenges around kind of structural policy type, initiatives. Let's face it, governments play a role in healthcare because ultimately it's really a coordination game. When you have programs like Medicare, it's effectively saying that somebody has to coordinate this from the outside, because if we leave it to the market fully, we're not sure that we can meet that baseline of healthcare access. And I think for a lot of countries, especially, globally, poorer countries, they are still struggling to find that level of coordination in policy, in government. And it's part of our role. Of course, we try and solve the problem, locally by providing software to pharmacies, by training people. But ultimately, we're also effectively lobbying governments to be more efficient, to be smarter in how they deploy capital for healthcare, and really just to be more visionary, to think longer term in how they deploy that capital. And it's a long game, and hopefully we'll see steps every month, every year, every couple of years, but really it's a very long game that we're all playing here.
Yeah, thanks for that, Brian. Excuse me, I certainly agree. Also kind of going on what you were saying, that these are moonshots, because if it was easy, it would have been done already. So it seems like what's left are the some of the bigger challenges, especially as the world evolves, so do needs and challenges too. So that kind of moves me to the next question about how, a lot of our DI members are product developers from different backgrounds, so software developers, clinicians on teams, those sorts of things. And so one of the common threads is, how can we be sure that the products that are being developed are truly fit for purpose for the populations that we're trying to reach? Now, with the kind of unique backgrounds that your patients show up with, how have you designed your products to be fit for purpose for the multifaceted user and the multifaceted needs for both of you? And I'll start off with Brian, if you don't mind.
Yeah, definitely. It's a great question, right? Because I think healthcare is one of these really interesting spaces where you can tell pretty quickly if somebody is using your product or not, right? For us, we have products that face pharmacies, and we have products that face patients. And I remember, I think in our first year of operation, maybe kind of towards the end of the first year, within the pharmacies that we operated, we tried to launch an e-commerce play. So, you can order from your home and we can deliver it to you whenever you want. And I think maybe one person used it, but really, most people really wanted to come to the pharmacy and physically meet the pharmacist and have a conversation. And, that kind of lent like an element of trust to the whole transaction for them. And we learned really quickly that, okay, yeah, there's areas where technology makes sense, but there's areas where we've got to kind of keep, that physical interface. So, I think it's, ultimately, like in anything in products and innovation, it's about listening to your user. Sometimes it's what they say, but very often it's what they do. Because they may not actually know, what makes sense for them upfront. And then it's ultimately also kind of being really quick in adapting as you learn about what actually makes sense for them. For us, one of the things that we've learned over time is that, okay, so for sure they want to have that physical interface, but actually they love it when you have like a very clear profile of who they are when they walk in. And so technology can play a role there to make it really easy and smooth for that transaction to happen when they are there physically. But you can't really rely on them to have fantastic internet access at home and do things from home. But you can kind of almost give superpowers to the pharmacists, the healthcare professionals to help them. Yes, I think I would frame it kind of broadly as really all about listening and observing. And then being super quick to adapt based on what you're learning.
Really like that, Brian. Thank you, especially the concept of listening to the end users, preferably during development and not only whenever it's on the market, but also throughout too, because I think that they're the biggest stakeholders for actually our entire careers. So thank you for that. Miguel, what about you?
Yeah, just to piggyback off of what Brian said a little bit, there's a phase as we were building our newest product where all we did was go through and read comments on social media and look at messages and what were people asking for, what was missing, where are the gaps. And I think something important for us as digital health entrepreneurs and new digital health entrepreneurs who are thinking about taking a challenge is understanding the world we live in today allows you to do faster tests much more affordably. And we have to bring more of that into the healthcare space because I feel like When you're building new healthcare products, we always think in terms of it's going to take multiple years to get to market. It's going to take lots of money up front. It's going to take all these compliance and legal things. And that can be difficult to do, especially when you're trying to get some user feedback quickly. You need to have something that you can test, that people can use, that they can show you what they're doing with it. And before you even get to that point, one of the things that's helped us, and I was talking to another digital health entrepreneur yesterday, is just understanding what people are doing in the modern world. So we built multiple apps for diabetes, and in the first two didn't do great on engagement. A similar story to Bryan's, because we thought they needed this, and what actually turned out was they didn't need all these bells and whistles. They just wanted to text us. So we opened up for text message, and that eliminated a whole application that we spent money on and thought was the greatest thing ever. So that's a big piece of it, is the lean methodology. How can we bring that into healthcare to get small tests going quickly, where we can get real feedback, see what's working, see what they're really doing with the products we're giving them. And then from there, we can get more sophisticated, build the full stack development, raise the funds, and so on and so forth.
If I can just add one thing to that as well, Rachel, I think there's something really interesting with that mindset of lean in healthcare, because I think a lot of healthcare people like naturally are averse to being very lean, right? Because we're like, we don't want to, we're saving lives, right? We don't want people to die because, we cut out this really important thing. But I think there's a fine balance, right? I think that, like we're way on the conservative side, right? We can probably move a couple of steps towards being a bit more experimental without sacrificing safety. And definitely, my team, the pharmacists on our team, we're always having that conversation. But I think it's a broader healthcare phenomenon, right? Where, we're very, very conservative because we're involved in saving lives.
I agree with what both of you were saying. I think it's also uniquely poignant for the digital medicine space about how historically healthcare innovations have taken just forever to start and to be on the market, for good reasons too. But with that being the benchmark, I think the idea is that anything we create just will take forever. But with Miguel saying in this technological age, no, everything is just so much faster now. And going on what you were saying, Bryan, it's really hard to kind of marry the two. The background that we've all kind of had about how things take forever, but actually not anymore, especially with the digital medicine space, requiring clinical quality evidence on a tech timeline. It's a unique place we all find ourselves in, and so also going off what you were talking about previously, Bryan, about building trust with your end users, with the patients and the people that you serve. We had a great question that came in from Jennifer Goldsack in the chat. She is the executive director of Dime, and she's asking, so as your teams have worked really hard to improve access, you've surely often bumped into questions about trust too. That's a big concern for a lot of people have about technology, not just healthcare technology, but also tech specifically. And when you layer on the healthcare aspect to any technology, it adds a bit more trust kind of questions and concerns from your patients. So what are the specific questions about trust that your patient populations have kind of given to your teams, and how have you been able to sort of overcome that? Can I start with you again, Bryan?
Yes, absolutely. I think it's interesting. I can speak from a Nigerian context where our pharmacies and our software is based. But it's interesting because there are kind of two types of patients that we have. I think there are those who care immensely about trust, and for them, the way that manifests is that, and as they should, right? Because there's very high incidence of safe medicines and a lot of issues for them to deal with. Often the way that manifests is that they stick to old behaviors, and they are less likely to embrace new technology because I know that guy who I bought my anti-malarial from 2 months ago, and that worked, so I'm just going to keep doing that over and over again. And it's and even if something is cheaper elsewhere and is actually just as effective as the one that I bought before, I don't know. Maybe it's fake, right? Let me just kind of stick to the one that I know just in case. So I think there's a lot of education for folks like that to kind of show them that for sure expensive things tends to correlate that more expensive is more likely to be real, but you can also get generics that are, just as effective and are much cheaper and can actually help you out quite a bit. So we spend a lot of time educating, folks like that. We do that mostly in pharmacies by training the pharmacists to get them to understand the nature of, what they're purchasing. But I think there's a whole different population of patients who, it's a really tough market. Typically your earning power is very low for many of these patients, especially as you keep going down the ladder in access. And I mean, they're effectively gambling to some level with their lives, right? Especially when they're in emergencies and maybe their kid is sick or somebody very close is sick. And there it's the opposite message. It's like, even though it's really cheap, you gotta be really wary of going to places that look like that, because there are reasons why it's so cheap. And we find that sometimes you can't tell when somebody walks in. You don't know if they're like population A or population B, and you've got to speak to them to better understand. And sometimes you're lifting them up in terms of education to understand the differences, and other times you're like, great, that you have to be careful, but you can be careful, and you can also be more efficient than you are today. I think it's a journey that the whole system is going through because of the kind of nuances of the challenges we have in markets like Nigeria. But yeah, we try and play our part mostly by educating pharmacists to educate patients.
Great, thank you. I think, Miguel, with the whole concept of lifting people up with education, that just might be the thesis of your work. Can I throw you that question about trust?
Yeah, that's, man, you hit it right on the head. It's the education piece is so important. And that's really the whole core of our business is we educate first, we deliver value first, and then we position ourselves as the authoritative figure that can be trusted. And in the social media landscape specifically, trust is just getting crushed right now because of all the fake news, all the fake products. I seen this hilarious meme yesterday, and it was just a highlight reel of products people bought off social media and how they came back just completely terrible. So somebody posted a picture of some really nice boots, and then the boots came and they fit on their fingers. And they're like, this is why I don't buy stuff off social media, which is interesting because we ran into that same problem. We had a bunch of glucose devices donated to us. We put out a big promotion. Hey, we've got all these glucose devices. You can get one for free. And at first, people didn't trust it. They're like, this is a scam. Nobody do it. As soon as the first person came and received their glucose device, all the orders just started piling in. So that credibility with the patient, once you can serve those first couple people and you can get them to talk about it, that accelerates the trust factor so quickly. People trust each other. They trust other people going through the same thing. And in the social media landscape, that is, if you don't have that, then you're pretty much just, there's no chance for you because people are not trusting these new services, these new products. They think they're being taken advantage of. They think their data is being all collected, which in a lot of situations it is. So for us, it was about, let's get some people who will take a chance on us and let's get them to talk about it. And that's really helped with the trust factor. And we'll continue to do that, continue to have users come in and tell their stories and use them as almost our brand ambassadors, which everybody does with testimonials and things like that. But that's been a key factor for us, is people with a chronic condition helping other people who have the same chronic condition and letting them know, hey, this is a way you can go. They will help you. They'll get you the resources that you need.
Yeah, I think that's really great too. It's kind of ironic about how healthcare is just really unaffordable for a lot of folks. But whenever there is a great product that is free or very affordable, folks don't trust it. So for a good reason, of course. Plenty of people have been scammed historically or treated poorly historically, as we know. So it's a bit of a struggle. But I think that getting kind of early adopters to really show how great your products are is a really great way to help build trust within communities and within groups to help with that. Something you said earlier, Bryan, really got me thinking, and this is actually going to turn into a question for you, Miguel. So Bryan, you were talking about how the healthcare journeys for different groups of people is of course distinct, and you were sharing about what it's like for folks in Nigeria. So Miguel, can you explain about how the healthcare journey is distinct for your patient population primarily, Spanish speakers with diabetes? And also, is it type 1 and type 2 diabetes as well too? So if you could explain kind of what the healthcare journey is like for the specific populations that you reach.
Yeah, definitely. And so we help mostly type 2s, but we are helping type 1s as well, and we'll continue to expand our services there. And type 1s traditionally are getting more access to services because it's a lot more serious, and it costs a lot more for the health plans up front, versus type 2 is called the silent disease, because for so long you can continue living your life like you never got diabetes, and then out of nowhere it all hits you at once with the complications, and then you become really expensive for a health plan. And for us, especially internationally with our Mexico users, the journey was just so different. Somebody would come in, and in Guanajuato, for example, we have a bunch of users, and they would barely have their medications covered. They wouldn't have a glucose device covered. They haven't seen a certified diabetes educator. The pathway for them is completely different than one of our users in New York who just left the meeting with his endocrinologist, has another follow-up in 2 weeks with doctor number B, actually has a home health specialist who comes in and does the grocery shopping. So for us, it's about how do we be flexible in these pathways? How do we understand the absolute worst situations where somebody's not getting meds or not getting a device or not seeing a doctor? And how do we provide services there, as well as come all the way down to the other opposite end of the spectrum, somebody who has it all right down the street? How do we help them take advantage of those resources that are available in the best possible way? And although we want to be able to help everybody, it's much easier, of course, to help somebody who's got more access and for us to deliver there. But the core of our mission is, where can we start to connect these dots and bring in other stakeholders so that we can start changing what's happening for the people who don't have the access? And I think a next step in that situation is similar to what Bryan said. There's some lobbying involved. There's some negotiations and trying to move things forward slowly, hopefully taking advantage of some programs that are available. I know in Mexico, before COVID hit, for example, we were about to fly down there and take advantage of some local grants, so that for those people who didn't have devices who were on our platform, we were going to supply all of those, and we'll still get to that as we can travel safely and move about as COVID subsides. But that is a big eye opener to us, is just that spectrum of seeing, here's one journey way on the far left that is going to be difficult to really serve them everything they need to be served, but that's where we're headed. And then on the far right, this journey is completely different. And then how can we leverage technology, leverage these user experiences to make sure all of those pathways are being optimized to improve health outcomes over time? And so as we get those different users coming in, we're able to now understand what that journey looks like for them on both ends of the spectrum, and we can build for those different journeys and start to account for the things missing along the way.
Thanks, Miguel. I appreciate that. That's all really important things to also think about. So we have a really great question from one of the audience members. Excuse me. I want to see if we can have this person ask their question live. Fabrizio, if you can hear me, are you unable to unmute yourself and ask this question? I'll ask it live if not.
Hi there.
Hi, Fabrizio. Can you give a
Hello.
quick background on who you are and ask your question to Bryan and Miguel live?
Sure. I'm a professor at University of California, Los Angeles. I've been working on developing diagnostic devices and wearables, and more recently been involved a little bit more in, as you can imagine, in the whole data mining and craziness about artificial intelligence and machine learning. And one of the big issues I found in all these is that in this world where everything gets disposable and the attention span of people it's lowering on a daily basis, how do we keep patient engaged? I know there's a lot of discussion in gamification of the digital healthcare, but is that really the answer to keeping people engaged, which is very important if we want to crowdsource the data and fill the gap of people that might not have access or be engaged enough to be able to wear our devices or check our apps or be engaged in this digital healthcare. I don't know if it's clear, the question.
Yeah, definitely is.
Hello?
And if you want to go ahead, Bryan.
Yeah, absolutely. Yeah, so I mean, I think it is very clear. I think it's a big issue for us. You know, we're not in medical devices per se, but I think that question of, you know, engagement and education is something that we grapple with all the time. And really, you know, we think of it in a couple of different ways. Firstly, it's around understanding that person's where healthcare fits into that person's journey, right? I think earlier on I spoke about how for a lot of people, you know, they think about healthcare when it's an emergency, and they never think about it outside that, right? So it's like, how do I get involved in the conversation before it becomes an emergency? You know, for us, it really means getting involved in their community, like going to churches, going to like community meetings, and like, you know, spreading the word in a more safe environment, I guess, like somewhere that they feel comfortable, and getting trusted members of the community to say the right thing. For example, you know, for a while we had, you know, every last Saturday of the month, we would invite like you know church leaders, like, you know, local kind of women's groups and, you know, things like that, to say a few words and encourage people to take their blood pressure, to check their blood sugar, and really just kind of do a general body health check to understand where they stand. And that was really successful, but not because we said anything, but because people they trusted said something, right? So, you know, maybe that doesn't directly relate to the products that you're trying to market, but I think that the principle of, you know, getting trusted members of the community involved in that process for engagement, you know, I think works pretty well. And then I think, you know, for us, we're increasingly finding also that, you know, the places they spend time on the digital world. So, you know, social media, for example, is a good place to bring up that conversation, but not in a way that is too direct, because it, you know, it scares them. It might be a cultural thing, but, you know, often when people think about death, they look away. But if you can kind of feed it in like a funny way, almost like a lighthearted way, you know, we've tried these things like, you know, so hypertension is a massive issue in a lot of Africa. So we have this, like, you know your numbers game, where, you know, you try and guess what your body age is based on, you know, your historical behaviors and, you know, whether you smoke or not or things like that. And that's kind of seen some traction. Whereas if we said you're gonna die, you know, because you have high blood pressure, no one's gonna engage with that, right? So I think it's also how you kind of tone the message in.
Yeah, but I guess to piggyback off of that, one of the big things that we're discovering is, especially in today's world, there's a ton of research going into human motivation. So understanding I think there's a couple factors. So it's human motivations being one, understanding that fully. Two, what's the culture saying about healthcare? So one of the things I always bring up is our company's really built around the marketing aspect, being on social media, being content first. We think of ourselves like a Netflix rather than a digital health company. And what Coca-Cola and McDonald's have done so well, unfortunately, is drinking a Coke and eating a hamburger are the coolest things that you could do on the planet. They make you so happy, obviously, from the commercials, and they're branded just so well. And so that's something I see that there's a lack of in healthcare. Nobody's excited about doing their healthcare tasks because it's not the coolest thing to do. Everybody's not doing it. All these different small factors that play into how we act as humans. I think if we can start accounting for those a lot more. One of the things I noticed about myself and my dad, for example, who has type 2, my dad and myself, we look forward to watching our show on Netflix or Hulu that comes out on Sunday. But my dad definitely does not look forward to his next checkup in 2 weeks to get his new number. So how do we switch that dynamic to where we're excited about those next steps, about understanding more about ourselves, about learning where we're going on our journey? And if it has to do with our health, it's going to be more challenging, obviously. But I think we can learn a lot from those companies who have just taken over, got everybody doing what they wanted, like the McDonald's, like the Coca-Colas, and trying to take some lessons there and apply them to digital health.
Awesome. Thanks so much for that great question, Fabrizio. Really appreciate it. And Bryan, Miguel, I think it's important for us to kind of think about how we talk about healthcare, not from a fatalistic standpoint, but from more an empowering, ongoing conversation. All right, we're coming up right on time, so 30 seconds each. Closing words from each of you. Bryan, can you kick us off?
Yeah, absolutely. I mean, I think firstly, I think it's fantastic to have forums like this, right, where you have people that are solving different elements of the overall healthcare moonshot, access to healthcare moonshot. And for me, the thing that it really brings to fore is how important collaboration is. You know, I think we're working on so many different elements of this, but ultimately, you know, just like that parallel that I drew earlier about how, you know, a bank sitting in Mauritius can speak to a bank sitting in New York, and they have these interfaces where they can really share information. We've got to get somewhere in healthcare where we can collaborate way more easily than we do today, and we can share best practices. And we can connect healthcare professionals in one location with, you know, professionals elsewhere. And so I'm excited by, you know, what you guys are doing, Rachel, at Dime. I'm excited by Startup Health work. And you know, really just want to play our part in trying to drive, you know, access to healthcare as high as possible and get us to the moon. So thanks for having us. Happy to be here.
Yeah, definitely. Just grateful to be on this panel. Love getting these conversations going, seeing what other people are working on all around the world. It's such an exciting time to be alive right now, to be tackling these challenges. And it's difficult, but with the people like we have in this group, with organizations like Diamond, Startup Health, I think we can do it. And we've got to start looking at, I think a big factor of that, like I mentioned just a little bit ago, stealing from companies like Netflix and Coca-Cola and McDonald's in the digital health space as entrepreneurs. Let's start taking some of these things that work really well in other consumer-facing arenas and B2B arenas, and let's start applying them. Let's start testing them. Let's start seeing where we can solve some problems in new ways outside of the traditional healthcare bubble.
Great. Thank you so much, Bryan Mezue from Lifestores Healthcare and Miguel Johns from KingFit and DiabetesCare. Thank you so much for joining us. I'm going to try and last couple seconds, you guys are being so kind with extra time. We're over the hour, but coming up next for Dime Programming is we are very excited to have our next webinar be about impact. This is a very exciting initiative that Dime has just very recently kicked off about virtual first care. So please join our webinar on March 9th to hear from our leaders from that. And then following up, of course, is Dime loves collaboration, as you can see. We'll be talking with our friends at Deloitte about a project we did talking about personalized therapies and the future of health. So be sure to join on March 25th. So thank you, everyone, for your time. Thank you especially for everyone joining live on the line. And thank you for Bryan and Miguel again. Thanks, everyone.